Breastfeeding provides complete nutrition for your baby's growth and development. When you breastfeed, you not only provide food, but protection and warmth. That is why the World Health Organization recommends exclusive breastfeeding in the first 6 months of life and to continue breastfeeding until the age of 2 and beyond. Breast milk is made exclusively by every mother for her own baby. It is packed with a unique growth factors, hormones, and many secret ingredients not found in substitutes. Arm yourself with the correct information to have a good start and gather the right support to keep you going. It takes a village to bring up a child. Even if you cannot breastfeed, there is still significant advantage from continuing to breastfeed even in small amounts. As breastfeeding burns up a lot of calories, it may help you shed the extra weight gained during pregnancy. And it also reduces your chance of getting some conditions like breast and ovarian cancer and even diabetes later in life. Breastfeeding is free, environmentally friendly, and creates a deep and lasting bond with your baby.
Mother's milk is food and medicine to your baby and changes over time, adapting to the growing needs of your baby. Most infant formula are based on modified cow's milk and continue to improve their products to be as close to mother's milk. Babies who are not breastfed have an increased chance of the following. Breastfeeding is something you and your baby learn together. Breastfeeding during infancy has a tremendous effect on how healthy he or she will be in the future.
Milk production or lactation occurs in 3 stages. The first stage begins early in pregnancy. It is not uncommon that the woman's breast becomes more sensitive and tender. The pregnancy hormones will make the breast glands grow and proliferate, ready for milk production. You will notice your breasts enlarging, and some mothers may even have to change their bra size. But do not worry, the size of the breast does not determine the amount of milk that you can make. The second stage begins after delivery of the baby and placenta. With the fall of the pregnancy hormones, breast milk production begins. When the baby suckles, there's a surge in prolactin, a key hormone that drives milk production. Stimulation of the breast or expressing breast milk using hands or pumps also stimulate prolactin. Remember, demand increases supply. With suckling, signals are sent to the brain to make more prolactin. This in turn stimulates the breast to make more milk. Thus, the higher the demand, the greater the supply. Most women will feel increased breastfulness usually by the 3rd day after delivery. Breastfeeding should be on demand, and you will have to feed your baby 8 to 12 times a day. It may be after half an hour, 1 hour, or even 2. So sleep when your baby sleeps so that you will have sufficient rest. Many little things such as hearing your baby cry, thinking about the baby, or even preparing to breastfeed can make the milk flow. On the other hand, fear, pain, embarrassment, or even anxiety can make it difficult to breastfeed successfully. So make sure you have enough to eat and drink, sufficient rest, and the necessary support for a successful breastfeeding journey. I wish you all the best.
One common question that pregnant mothers ask is, how do I prepare to breastfeed? Here are some tips that will help. First, arm yourself with knowledge. Breastfeeding is natural, but it takes time for both you and your baby to master this new skill. You can attend classes either in person or online, or join a breastfeeding support group. Bring your partner along so that they will know how to support you in your breastfeeding journey. In SGH, our nurses will help all babies who are medically fit to be placed skin to skin with the mothers after birth. We also encourage rooming in so that you can breastfeed on demand. Good posture and comfort are crucial for a good latch and allowing let down. Use pillows or cushions to support you and your baby when required. Prepare a nursing basket to keep your handphone, a large water bottle, and snacks within reach. It's important to be well fed and hydrated while breastfeeding. Supportive and nursing-friendly clothing and bras will keep you comfortable. You can also consider a breastfeeding cover for feeds on the go or for pumping at work. Nursing pads will help prevent leakage and shirt stains, especially in the early days after your milk has come in, but before your milk supply has regulated to meet your baby's needs. Lanolin, nipple balms, or silver cups are helpful for sore nipples. lanolin ointment can be obtained from the hospital after your delivery. A breast pump is useful if you like breaks from direct feeding or if you are planning to go back to work. Learn how to set up and use these before you deliver. It is important to ensure that you choose the correct flange size for your pump. This can be done by measuring your areola. The nipple should move freely in the pump. There's a wide variety of bottles and teats available. If you are planning to combine latching and bottle feeding, choose a slow flow teat to mimic the flow of milk at the breast. You will need bottle and teat brushes, a method for sterilizing bottles, teats and pump parts, as well as a place to store your clean equipment. Breast milk storage bags are used to keep your milk in the freezer. These precious milk packets should be kept away from raw food. A cooler bag and ice packs will allow you to keep your milk cold if you are transporting milk, for example, to infant care or home from work.
The first hour after the birth of your baby is often called the magical hour. It is a special bonding time that begins when your baby is placed skin to skin on your chest right after baby is born. The care providers will help to dry the baby, put a cap on, place the baby belly down on your bare chest, and cover baby with warm blankets to get you and baby settled snugly for the magic hour. Your heartbeat will calm your baby, and he or she will smell your breast milk. After the initial birth cry, your baby will relax on your bare chest for a while, followed by an alert period of finding his or her way to the breast for the first feed. You should keep doing skin-to-skin time with no interruptions until your baby finishes the first feeding. Make skin-to-skin part of your birth plan. Talk to your doctor to make sure they support skin-to-skin time during the magic hour. Skin-to-skin helps mom and baby get off to a good start with breastfeeding.
Mothers often ask, how safe is skin-to-skin contact? It's very safe when mother and baby are positioned properly and observed. Nursing staff will be around to observe mother and baby during this time. If I'm expecting twins, can skin-to-skin still be done? Absolutely. Each one is positioned side by side, one over each breast. What if I'm not feeling well enough? Let the staff know if you're not feeling well enough to hold your baby. Your partner can also hold the baby skin to skin until you are ready. How does this work if I'm having a cesarean section? Many mothers are alert and able to participate in skin-to-skin contact even after cesarean births. Skin-to-skin contact can start while you are still in the operating theatre and continue in the recovery room. Special support and warm blankets will be provided. Colostrum, which is rich in immune-boosting factors, is the first milk produced. Although very little is made in the first few days, colostrum is of high nutritional value and sufficient to meet the newborn's nutritional needs. Called liquid gold, colostrum is packed with nutrients which cannot be found in formula milk. It is easy to digest and it helps line the gut with a protective layer that safeguards against future infections and diseases. It is normal to make only 1 to 4 teaspoons of colostrum per day. Remember, your baby's stomach may only be the size of a marble on the first day. If your baby has any trouble latching and breastfeeding in the first hour, it is very important that you hand express to remove some colostrum from your breasts. This early stimulation will help get your breast milk supply going, even if your baby wasn't able to suckle at your breast. To hand express, position your hand on your breast in a C hold. Your thumb and fingers should be a few centimeters behind your nipple. Gently push your breast back towards your chest and bring your thumb and fingers together in a gentle rolling motion. This will move the breast milk out of the milk ducts.